When me touch down, better broke down.
With Gamtel G-Fiber, now you can enjoy super fast internet in gigabytes. G-Fiber is affordable, stable, secured, and accessible to homes, businesses, and enterprises. With Gamtel G-Fiber, the future is speed. Gamtel, creating a brighter future in communication.
That's how she became mine and see the.
All right.
Honey, did you remind him that the last time he sent the money, it was not enough to buy all the provisions?
Oh, sorry, I forgot to tell him.
Are you guys talking about money transfer to buy provisions?
Yes.
But don't you know about Baluwo?
Baluwo? What is Baluwo?
Baluwo is a service that your son can use to send provisions directly to you guys from the shop. And you don't have to worry about the exchange rate.
Tell me how Baluwo works.
It's very simple.
Just log on to baluwo.com and shop, or download the app on your phone. You can shop on the website or using the app to buy online basic products for your family and friends. With Baluwo, you decide what your money is spent on. Your money, your choice. Buy online products for your family and friends in the Gambia, Senegal, Nigeria, or Mali. Baluwo, better than sending money.
Are you thinking of owning your dream homes? Njie Investment is here for you. Secure our quality bungalows with 2, 3, or 4 bedrooms, or our story buildings, 3 or 4 to 5 bedrooms at very affordable prices with flexible payment plans at our Sanyang Seaview Estate, where you can enjoy the cool breeze with modern infrastructure such as tar roads, covered drainage system, modern electrification with street lights, gated entrance with security posts, and social amenities such as gas station, shopping mall, medical clinic, park, schools, children daycare, and a lot more. Our dedicated team of professionals will keep the estate clean at all times, provide security and patrol team within the estate premises, install latest technologies such as CCTV, Wi-Fi, home network installation, solar panel, and power backup system. Also, check out for our additional home facilities and interior design service such as premium tiling, wall plaster, home landscape, fingerprint home lock, and a lot more. Visit our office at Senegambia Kololi Highway and get a free site visit tour, or contact us on 4464-838. WhatsApp us on 3259220. Or you can visit our Facebook page or Instagram on Njie Investments. Njie Investments, we are first in properties.
In communication, connectivity is everything. We ensure that the links never sleep. Quantities and qualities, all in our data service, providing efficient, reliable voice and data service. We believe if you're not up to speed, then you're going backwards. Communications have to flow as fast as the speed of light. Whatever business you're in, having someone who understands your needs is critical. That is why we just don't offer you technology, we offer you solutions. Enjoy Gamcel's internet broadband anytime, anywhere. Your national operator, Gamcel, Yaibaram.
I get it.
Mbijano aganyani.
Albaka.
Mbaka important.
Yo, nga transfer la sto.
Ya transfer la sto.
Ha, code nyingi.
Okay. What's on?
Nsila ID soto.
That's sorry. I get it.
Mbijano
Albaka.
Mbaka.
Bara alla service o tariaka.
Mbale.
Mo ki janna nun kunu bara tariaka.
Janno mi yona forest de bureau. Gambia tonkon na no mbali ya bere. Birim koyna fo kato.
Bari si kodo kino kato ni fo bolon blabe.
56 branches mola soto Gambia jam. Gambia kono ani Gambia bankala bankol. Nko kodo kiya bere. Kodo sifa fo falindiro fo nyaadi lafta memmen na kodi topoto nin kodi maraw. Jannom number 1 ti nyonta. Andum fana nata anoda enterprise sotale. Wolam nyindi ko domorol fana kol fana be firale le dadi ma ni domorol ni fana beteata. Gambia dawda yalo ngam fa kendol sotale je.
Wo moyo diat
apelenta
baraka. Ni waka ni na lafta nyelen kendo le bina.
Yalo bukani la ko la baraka ba.
Yalo ndel chosano lo.
Baraka.
Hello and welcome to the Brunch and on Kerr. I'm Lamin welcoming you to this edition of the program. And of course, as you could see in your screens now, you know very well that the Gambia has been caught up in a really devastating spike in the spread of the coronavirus. At the moment, well over 1,000 cases have been registered as confirmed positive. Out of it, officials said 19 deaths and several hundreds are still active, while some others there have been scores of recoveries too. Now, the whole country have been gripped with frustration, anxiety, if you like. And now to make sense of all this, we have with us here on this Zoom, the PRO, the Police Public Relations Officer, Lamin Njie. Hello, Lamin, are you there?
Hello, I am around, Mr. Chan. Thanks for having me.
We have Mr. Baboucarr Sankanu, who is in the COVID emergency team as communication specialist. Sankanu, are you there?
I'm here, Mr. Chan. Thank you.
Fantastic. And Doctor, of course, everybody knows him since at the beginning of the crisis, Modou, Njie, Director of Health Promotions, is also with us here. Gentlemen, welcome to the program. Right, Njima, I'm also told that. All right, I'm also told we have Njima Camara. Yeah, Njima Camara, our usual panelist, who today is joining us from Springfield Town, Illinois State in the United States of America. Njima, are you with me?
Yes, I am.
Wow, congratulations. How is Springfield Town, Illinois this morning?
It's very early.
Good. I've been told by the technicians that you need to turn a little bit so that your face can come upright or horizontal or rather vertically as all of us are.
Oh.
Yes.
But that will be a problem because I'm using my phone and it needs to charge.
All right. It's already done. I think it's already done in our studios now. Okay.
Yeah, all right, I'm low on my battery though.
Okay, very good. Now we go straight to Dr. Modou Njie, Director of Promotions. Dr. Njie, let me first ask you, what has led to this sudden rise in the number of COVID? Is it a case that there are now more testing is happening, or is just people getting sick and turning up at hospitals?
Mr. Chairman, I'm not getting your question clearly. Can you kindly repeat that question? And then I also want to correct that I'm not a doctor, but I would like to be
Now, my question is, what do you think has just led to this sudden rise in the number of COVID cases in the Gambia? Is it because now we are getting more and more people tested, or there have been an influx of people who have arrived from abroad, or is it a simple case of Gambians getting sick and turning up in hospitals, as is not the case before? What led to this sudden rise, according to you?
Basically, I would say it's linked to so many factors. And then one of the factors I would say is linked to people not adhering to our messages since day one. As you know, we have been talking to people for so long and then trying to raise awareness, trying to convince people adhere to the precautionary measures. Key among them is to observance of social distancing, wearing of face masks, washing of hands, and I think this is something that we have been talking about. I think the message have gone, but the message have not been adopted. By many people. We also link it to about two main ways: the opening of the airports, and then as well as also the loosening, of the restrictions, and as well as also the movement of people on the land borders, because as you know, the land borders are not open, but people are still finding their way in and out of the country. And then they are using the illegal, and like, we also have identified points of entry, but people are not using those identified points of entry. Instead, they are using other means to come to the country. And then we've also increased the number of testing. We have raised awareness for people to come out in numbers to go and test. And the testing have started, and then people have been coming in their numbers, and that's why it's also increased. Because if we started testing earlier on, as we have been doing now, I'm sure we could have even registered more and more cases. But now that people are now seeing the need, at the beginning, yes, testing facilities are available, but people were not also coming out because many people don't believe that the disease does exist. Now that they believe that the disease exists, now that they feel that they want to know their status, and this can only be done through testing, and they are now coming forward. And that is also increasing our numbers. As I speak to you now, we have a backlog of samples at the National Public Health Laboratory. And this is why this past 2 days we couldn't do any testing or sample collection, because the samples that have been collected about almost 900 plus samples. And these are the samples that have been processed now. They've been, the scientists are working on it to work on the samples and to come so that the results can be available. And that is why many people are complaining that they've tested and they couldn't get the results. And that is because of the fact that we have backlog of samples that have been collected, and we are trying to finalize those samples. And then I think for me, I link it to some of these factors that I may be aware of, but there could be other several factors. And also that we have also strengthened quarantine, because as you know, when we did not introduce quarantine, especially the mandatory quarantine, I think people would have just come and they'll go into the communities and they will not be tested. Perhaps they'll be positive and they'll be living with the communities. But because we have introduced quarantine, mandatory quarantine of 14 days, whereas when people come in, at the beginning, we were not been testing people when they were coming to quarantine. When they come in, we quarantine them and then we allow them to go after the 14 days. But now when we started testing, what we introduced was when they come in, the first day they'll be tested, and if they are negative, they will still stay in quarantine for 2 weeks until the last day of the last 2 days of their stay, and they'll be tested again. If they are negative, they're allowed to go home. But anytime they are positive within quarantine period, they'll also be taken to the treatment center. So this is what we have also instituted. And perhaps because of the fact that we have a robust system for quarantine at that time, and now that we are also focusing the same strategy, that is why we are also getting the numbers. So when we didn't do the quarantine, perhaps we will not get the numbers we are getting now. I think this could be one of the some of the factors responsible for the increase in the cases.
Thank you very much. Thank you for now. Okay. You want to add another point?
Yeah, I was just saying that the issue of adherence to the state of public emergency regulations, and as well as also the precautionary measures, it has also a bit of relapse. And then there is a relapse in hand washing. This has been demonstrated in the communities we have visited some time ago. We visited about 135 communities along the borderland communities in the country, both the north and southern back. But what we have realized is that there is a relapse in the behavior, especially with regards to hand washing. And also we have also realized that people have been coming into the country because what they've been telling us that Gambia and Senegal, they are so much interrelated that some of them in Gambia have relatives married in Senegal, and then they are normally like 1 kilometer apart. So they feel that the movement between these two countries would be difficult to control. So perhaps that is also encouraging people to come in contact with each other in both countries. And that also perhaps that could also be a factor leading to an increased number of cases.
Good.
For now, I want to stop here for now until I come back.
We will, of course, come back to you with some other specifics about what is happening. I'm going to cross over to Baboucarr Sankanu, who is in the emergency committee responsible for communications. And you had a big story to communicate last week, actually, which is the imposition of a curfew under the new emergency powers introduced by the president. I want you to go through, apart from a curfew, there was closures of, religious, worshiping places again, plus, imposition on fines or penalties on people who used, as Mr. Njie said, unofficial borders, etc., etc. Now, tell me, why now and not before? I'm talking about a curfew particularly.
Actually, like I said, the response is dynamic. Gambia, we are in a situation, this is an emergency situation, nobody was prepared for it, it's happening, and we are responding and adjusting accordingly, looking at our context. We know that COVID-19 is here, it's not going to disappear from the surface of the earth. So how do we contain this pandemic without causing so much pain on the citizenry? And that's why any step that is taken by the government considers the well-being of the citizens. So when measures are taken, they are studied. For example, when the president lifted the state of emergency, there was this new infectious disease prevention regulation, and also the Public Health Act, which empowered the health minister to take actions, lockdowns, and other measures for a period of 90 days, which means that there was a delegated responsibility. And now that things we see that there are some adjustments, then we've seen the president coming forward with a state of emergency and a curfew. So the curfew, it's a lighter version of the lockdown. Many people are complaining about it, but officially there are a lot of nocturnal activities. Many people think that 10 o'clock is too late.
Exactly, I was coming to that. There's a lot of criticism that should have started earlier.
What people don't understand that we are privy to a lot of information. The police PRO is there. You go to bed, but people are there. The security. They do a lot of intelligence gathering. Take the case of those who organized a send-off party at Gusto restaurants and infected a lot of people. It was at night. They violated this, this closure of non-essential places by going to a restaurant at night, which was after 10 p.m. Organized a party, infected a lot of people. And then the two private hospitals, got affected. So the impact was huge. So when people look at the time, they don't know that the activities that are taking place at those times are very intensive, and it's based on evidence of that one. That's what decision is making. During daytime, some people might be shy because of sunlight, and also because of our community. People are looking at each other. They may not do certain things. But once it is dark, the shameness level goes down. People take a lot of risk, and they do it. So basically, it is based on that informed decision that the time was set. It is a decision of the president, and we are respecting it and we are implementing it. So you
still did not address concerns about the people that if you leave it up to 10 p.m., you leave it too late. Somebody can sneak in from here in Burford, go to Brikama, wine and dine with somebody and rush back before 10 o'clock. If it were 7 o'clock, they wouldn't have been able to do that.
The thing is that when you say 6 o'clock, shops are closed. If you understand that not everybody's having a private car, and mobility is a problem for a lot of commuters. You stay in Brikama, you work in Banjul. You know how it is difficult to get transport when it is rush hour. People spending hours at Westfield, at Banjul, looking for transport. So some people, it takes 3 or 4 hours before they reach home. So if we say 7 p.m., 6 p.m. curfew, you are going to have a lot of people stuck in traffic. So this is to give people enough time to prepare. And then we have to understand that a lot of people live from hand to mouth. You have to consider them. You know, there are day wages and they struggle to get home. Not everybody can hire a town trip, and the taxi, you know, their behavior. When there is a demand, they start to behave, increase prices, only insisting on town trip. How many people can afford town trip for 21 days? So the 4 hours, 6 p.m., markets being closed, up to 10 p.m., give people the time to reach home and prepare. Then by that time, 4 hours is enough for you to prepare and stay indoor till 5 a.m. So
Wow,
these are
good.
things that people can look into.
Okay, the closure of mosques and churches, I remember, was not a very popular decision when it was taken initially, and people were criticizing the government have been tough with others and soft with others. Now, what is behind the new boldness on the part of the government? You sit in the committee that advised the government to close the mosques and the churches, and has there been now greater understanding of the decision, or do you think there is still, you expect some resistance, it being a very sensitive matter?
To my knowledge, there's no resistance. Everybody applauded the decision. Even those who were complaining that mosques were closing before, they've all been complying. They were rushing to comply. Because at the end of the day, we responded, you know, I mean, it's an informed decision. Like I said, anything we do, we look at the Gambian context, and they have no excuse. Because Saudi Arabia, which is as the home of the 2 holy mosques, suspended, you know, Umrah, the lesser Hajj, reduced the number of pilgrimages. So they don't have any evidence again to come and say you people are fighting religion, restricting freedom of worship. And that the threat is imminent now. It has been declared, COVID-19 has been declared an imminent danger, threat to public health. And they are feeling it now. So they cannot resist, because, you know, you think that you are worshiping, but you are healthy. You know, you are wealthy, you are healthy.
So in other words, now you think probably there's more tangible evidence on the ground to convince the imams and the pastors.
Yeah, it is self-explanatory, and they know that one, you know. So if they want to be stubborn, and because, you know, it affected them, you know, most of it, you know, there was no exception. You know, if you look at the statistics now that we are anonymizing information, religious leaders were affected. You know, a number of them were affected. Operators of daras, the madrasas, some who speak to Senegal and others, you know. But now we don't announce those ones. But if you look at previous citrus, there was a mention of a marabout, there was a mention of Quranic students, you know. So they are not exempted just because they are worshiping God or going to the mosque, you know. So and they realize.
Fantastic. Now, the duty to enforce these regulations rests, of course, in the security, and they are represented in this forum by Piero Lamin of the police. Lamin, I was around out and about yesterday. I think it was about midnight, and I encountered a heavily secured or heavily, masked up security unit between Turntable and Brufut, and they stopped me. I had my car on double signals, and they flashed me from very far and asked me to stop. When I stopped, of course, a lot of them recognized me, but and I had press start on my car, and they said, "Sir, what is it?" Before I could explain, they understood. And they asked me where I was from. I said, well, I went around to see whether the curfew is being observed, and of course, I met a lot of security policing it. But Mr. Njie, so far, it's been 2 nights since the curfew has been imposed. What have been the feedback you received from your men? Example, did you meet a lot of violators whom you have arrested? Or generally, do you think the thing has been observed to your satisfaction? Piero Njie, are you with us? Are you with us, Piero Lamin of the police? It looks like along the way we may have lost the police public relations officer, Modou Lamin Njie. Okay, then before he comes on, let's go to Njie. In Njie Kamara, of course, you all know her on this forum, Kerr Fatou. He's talking to us from Springfield town in Illinois State, United States of America. Now, when this news spike came about, a lot of people in the diaspora, in the Gambia, or rather in the United Kingdom, in Sweden, in Switzerland, and in the United States, where you are, are very concerned and alarmed at what is happening back home in the Gambia. Now, what has been the feeling of the people in the diaspora there, especially people around where you stay?
Thank you very much, Lamin, for having me here. I think sometimes the reality could be different if you move away from your local setting to see what is happening in other parts of the world. We know that here in the US, there are people who are in denial of the existence of the virus. But my experience generally has been people complying with regulations. And my impression with that is that people have come to appreciate the existential nature of this virus. And somehow they have been convinced that it is ourselves that need to protect ourselves. And that is the reason why for most of us here in the diaspora now, our feeling has always been, even when I was in the Gambia, has always been that people are not convinced. And it is not up to people to convince themselves. It is up to the authorities to find ways and means to ensure that people are convinced, because they are they are sitting with knowledge that ordinary people do not have. And they are tasked with the responsibility to ensure that the regulations that they put in place are being enforced to its maximum extent. So when I hear, for example, Mr. Njie saying that people did not listen to us, they did not appreciate what we were doing, I ask myself, I tell myself that's not a failure on the part of the people, that's a failure on your part, because you have a responsibility to make sure that if your initial strategies are not working, you utilize other means to ensure that people listen to your message and we appreciate the nature of this virus. And for me, I think what is lacking in the Gambia is an elaborate strategy. There must be an elaborate strategy. What is currently happening is us acting reactionary to things as they happen. The proactiveness required that we really sit down and understand our context, understand the society, and how we need to approach with our messaging, with communicating, by utilizing the very channels that exist. For example, how do you work with civil society? The hand washing that he's talking about was not initiated by the government. It was the civil society, members of the civil society, that went around distributing these products to individuals, to compounds, and convincing people to do so. Initially, when the virus came, when it was declared a pandemic, many people took it seriously, and many people took it upon themselves to ensure that we are all being protected by distributing food, by distributing items that could be used for sanitization, and so on and so forth. It took a while for the virus to spread. And within that time, much people felt that the threat that they have been talking about does not exist in the Gambia. And that's where the lapse came about. And that was the time also that the government, and especially the authorities responsible for coping this virus, needed to intensify their efforts to make sure that the education continues, the communication continues, and their presence is felt. And this way, it doesn't take just their efforts, it takes collaboration with all the actors, political parties, opposition political parties in the country, religious leaders. I've seen just recently Kerr Fatou having religious leaders on their platforms talking to their congregations. Community leaders needed to be involved, the alcalos, the Kanyalans, whoever you have that has influence in their cohorts needed to be engaged, to be utilized as a voice that can represent the authorities so that their presence is felt, what they are doing is visible. We take it for granted that what we know is what everybody else knows, but that's not the case. What you know is not what we know. So if you sit with knowledge and you're not utilizing the channels that you have to ensure that your efforts do not go to vain, then that would be problematic. And that is what is really happening. The difference between where I am and in the Gambia is that people really appreciate that the virus is real and it's a threat to human lives. And for that reason, they take it upon themselves as their responsibility to protect themselves and to protect other people. And that cannot come through coercion. It cannot come through force. It has to come through communication, effective communication, and engaging people through the right channels.
Fantastic. And before I leave you for now, how has been the anxiety among Gambians since the new spike of the virus back home in the Gambia?
I think when you are away, like I am, you feel that you are safe. But I don't think anyone is safe because the virus is everywhere. So, for example, here, myself, my husband, and other colleagues that we have here, we all take precautions. We don't go out with masks. We make sure that we have hand sanitizers on us. Everywhere we go, we continue to clean our hands. We protect ourselves as much as possible. You want the same for your family back home because the anxiety is different. If you feel like you are away and you are not in a position to ensure that the protection you are ensuring for yourself may not be the same level of protection that your family have. So people are anxious, but people are also continuing to engage their families. I remember during the Tobaski period, I have myself, my husband, his friends here, we keep calling our families home to try to sensitize them, to try to convince them that the virus is real and people are moving from the towns to the villages to mingle with them to ensure that they protect themselves as much as possible. Initially, you face resistance. You hear people say, oh, the virus doesn't exist, but you continue to talk to them because at the end of the day, family members, the relationship between family members are strong in that sense that they will be willing to listen to you more than anyone else.
Okay, Nima, I think we have, thank you very much for now in Springfield, Illinois. We will get back to you soon. Let's cross over to Piero Njie. I think Lamin Njie is with us from the police. Lamin, are you there? Hello, Piero, are you there? No, we still haven't got, oh yes, it looks like he's there now. Hello, Piero, are you back now?
Hello, I am back again.
I don't know what happened because I hear some background. Maybe you went to have a bite. All right. Now, I was actually saying my impression of the enforcement of the curfew at least had been impressive. I had myself encountered, a very prepared team from your force yesterday enforcing the curfew at about midnight around Bruford area. I'm asking, so far, it's been 2 days since the curfew began, how have been the reaction or feedback from your men? Have you, for example, encountered a lot of Baboucarr violators of the curfew or whatever?
Thank you very much, Mr. Cham. Like you have said, when we got into the curfew, we had already put up an operational plan that we have duped as Operation Save Our Souls. And so Operation Save Our Soul, we had put contingency plans in all the regions of the country to ensure that they go all out to get people to comply with the curfew regulation. And so far, so good. People have been very, very complying to the regulation. In fact, we have issued a statement commending the general public for their support and also the fact that they are complying with the curfew regulations. And so from Banjul to West Coast up to Basse, we have registered a very high level of compliance. And if you look at the impact, like you have said, people like you who were out and about, you have seen how the streets were clear. And so that's an indication that the curfew is definitely going fine. However, we have no major incidents really, but we have registered some individuals at different regions, and as they report in, we are certain individuals have got arrested. So far from the reports that I have received, even this, we've got the tourism security unit. They have arrested about 18 people and also 11 vehicles that they have also arrested and do the process accordingly. And on Basse, first day they have about 15 people. The second day they have arrested 16 people. So it is among the Jaranka and the other people, like you said, they will still go out no matter what. But then those people have also been arrested. Now, around Serekunda, the report coming so far, but what I have gathered for the meantime, we have got about up to, let's say Brikama, we've got up to about 14 individuals that got arrested around those areas within the 2 days. And also The anti-crime unit as well have been going about, in fact, arrested certain individuals who were breaking or sort of dealing with stolen items, arrested people in between. And also have arrested individuals flouting the curfew rules up to about 11, 12 individuals as well. And other vehicles that were also equally flouting curfew regulation. And even up to CRR, that's the Jajambure area, they have arrested up to around 20 people in the 2 days because the area is a very area. It's CRR North and CRR South. So they are patrolling both east and so far they've arrested up to about 20 areas. The reports are coming in and the arrests are not very significant as far as the compliance level is concerned.
Now, what about the policing of the border? It's been said that if somebody crosses the border illegally, that is using the unofficial ways, it can be arrested and be fined $5,000. How have that been? Because a lot of people blame this for part of the reasons for the rise in the cases.
Very well. When it comes to border, especially the movement of people, the Gambia Immigration Department is the leading institution to deal with that. And what we do is usually to give them support and backing in the execution of this task. And so far we are collaborating with them to ensure that the border security also is strengthened and tightened up so that people who cross from across the other side of the border will not be able to have access into the Gambia.
And about the religious places, mosques and markets, I know when the crisis started back in March, when the businesses were scaled down in the markets, there were a lot of queries and complaints. Now we are back there now. How have so far people been reacting?
Mr. Cham, this time around, we are very impressed, even with the religious side of the whole thing. We could recall that when the first declaration was made, especially on the side of the fact that religious places have to close. I don't know whether this was a sort of a shock on the side of people, but the resistance was very high. But this time around, I think the message has synced such that we are not having much difficulty with the religious side. Many of the mosques have already closed even before they got to have any police officer patrolling around their area. And also we have, even in this declaration, it is said that certain mosques could be used to do announcements and call to prayer, but you hardly even hear that. Although we've got pockets of reports, people calling and saying, in my area, the mosque, the people are going there to pray, and then I will have to say, okay, we'll get some patrol team to patrol around the area and get the mosque closed. But we have got 1 or 2 instances of that. But generally, the compliance level is very, very high. I think the message is definitely sinking, and people are getting to understand the devastative nature of COVID, and so that's why compliance is really very high now.
How about motor cars, drivers? I heard there have been at least 16 or so convictions among drivers who picked people without masks. Now, is it the duty of the passenger who should have a mask on, or is also the duty of the driver not to pick somebody without wearing a mask?
Mr. Chan, the regulation is very clear. It says if a driver of a vessel, a car, or an operator of a vessel, if you allow people in your car or vessel without mask, that is an offense under the regulation, and you are liable to be charged under the regulation for allowing people in your car or vessel without face mask. And so that is why the drivers get charged for having people to enter their car. Say, for example, the seat belt. People get in your car, they don't put on the seat belt, the driver get charged for it. And so this regulation is going in that nature as well. This does not exempt people from their individual responsibility as well. Yes. If you fail to put on, if you fail to put on face mask, if a driver gets charged for it, you individual also who have not put on the face mask, you'll also individually be responsible for not putting on the face mask, and you get charged for it. In fact, we have arraigned individuals in court in Serekunda, and they are going to get fined as well as the drivers that got fined in Brikama and Serekunda as well.
Now, there have been cases of people who are actually in public place, but instead of putting the mask all over their nose and mouth, they just, leave it hanging around, say, under the chin here. I mean, is there any regulation for that? Because, I mean, that also defeats the purpose of wearing a mask.
Very well, Mr. Cham. It looks like we need more and more sensitization and more education to build on the consciousness of the people, especially their attitude towards the face mask. People must understand that the essence of the face mask is to cover your nose and mouth. But if you have it on your chin or on your head and elsewhere, definitely that is defeating the purpose. And in fact, if our officers go on patrol and they realize they've seen you with a mask but you have it on your chin, they will get you to understand that you have to put it on your nose and mouth to cover them up. In fact, what we have realized in between is that there are certain drivers that will have additional masks in their car and they will hang it on top. So what will happen if they get passengers who are not with masks, they'll just remove the mask from the vehicle on top and give it to them so that they will just pass the police checkpoint or the police checking. And the people will just put this on, cover them up so that they can just evade the police officers as they check the vehicle. And after that, they return it to the driver, and the driver continuously do this for the whole day because he's going to have like some kind of 2, 3, 4 extra masks that he has put in the vehicle. And this is only for the purpose of passing through police checks and so on. And people must be very careful with this. And also the health personnel will have more advice when it gets to this, to understand that COVID is about the whole essence of these regulations is to prevent ourselves from COVID. Now, if you have additional masks that you are giving to different people the whole of your day, how many people are using that mask? And in fact, those people who are accepting to use that mask, what definitely are they exposing themselves to?
Fantastic. Okay, Police PRO Lamin Njie for now. We will come back to, let's go back to Modou Njie, Health Communications now. Mr. Njie, this past week really have been very apprehensive, a very, worrying times for Gambians in that we have seen not just a rise in the number of cases, but of course we have seen deaths. Is very, very frightening to see people dressed in white, overalls, escorting dead bodies in towns with police. Bearing these things. All those sites have really led to frightening people. But then, of course, there are issues still. People say that there are not enough PPEs, there are not enough respiratory and ventilating machines in the hospitals. Virtually, there is no facility in the hospitals. That is really leading to a rise in the number of deaths. And people don't even believe that it's only 19 people so far who have died. What people said the government is really far behind in terms of provision of the adequate PPEs and facilities that are needed to mitigate this challenge. How fair are these criticisms?
Lamin, thank you very much. I'm happy that you are bringing this up. I wanted to bring it in my first intervention, but I'm happy that you're asking about the PPEs and its availability in our health facilities.
Yes.
I want to make it clear, and I want this thing to be on record, that we have adequate supply of PPEs at the central medical stores. And according to the director responsible for pharmaceutical services, who also doubles as the chair of the Logistic and Safety Committee of the National Health Emergency, Committee on COVID, has made it very clear that the supply we have will certainly take us up to the end of the COVID period. And I think what is important, if the hospitals don't have, it has been communicated since earlier on, they are supposed to make requests to the director of national pharmaceutical services for them to be given their supplies. And then the supplies, according to him, that has been received can take us up to the end of the COVID period, and that in fact the distributions have already been done to the regional stores, and they have the, according to what he told me, and also the hospitals, if they don't have, what is incumbent upon them is to make requests. So
how come with all this and our own health officers, a lot of them got infected?
That's what I'm saying.
Yeah.
Now I talk about this in our last discussion with my interview with Fatou. Basically, some of them they got the infection either at home or are they true? We don't know exactly. It could be true when they were going to work, perhaps the type of vehicle they use, or where they are working, the equipment they are working. But also we have realized that about almost 8 of them got the transmission that they call it nosocomial transmission, and the transmission has happened within the hospital. And this could be either linked to the hospital, the patient they are dealing with, or either it's linked to the equipment they are using.
And
so
that's a good point because people are now saying that the nurses actually are running away from patients who might not even have COVID, but they are just malaria.
That's
patients.
what I'm saying. You know,
they're running away from them because they fear that they make all the COVID cases.
Yeah, that's what I'm saying. I'm coming up with the options. Like I said, it could either be this or that. So one couldn't make a concrete judgment to say they got the sorry, I missed it.
Yeah,
that they got the transmission through dealing with a patient or dealing with an equipment within the hospital side, but the transmission really occurs within the hospital. So that is a concern, and I think that is why the hospitals, because they are semi-autonomous bodies, they are supposed to come up with guidelines and recommendations and then the policies within the hospital. And then one key among them is the building of capacities of the healthcare workers and ensure that PPEs are available for the staff at all time. And that this can be done through requesting to the National Pharmaceutical Services. So, but to say that the PPEs are not available, that is not a fair statement on the part of the Minister of Health. Yeah,
what about,
really, I consulted with the National Pharmaceutical Services, the person in charge. Actually, he made it very clear to me that the supplies we have for PPEs can take us up to the end of COVID period. So this is really assuring.
What about ventilators? Ventilators. I mean, there have been, concerns.
The ventilators, I cannot comment on that because what happened is I don't know exactly at this point in time how much do we have in operation. But what I can say that if they are not at the hospital, it is incumbent upon them also to contact the National Pharmaceutical because they are in charge of logistics.
We had when the ambulances were brought in from Turkey, I mean, we were told that there are a number of hundreds, or even if not thousands of ventilators. What happened to them?
That is what I'm saying. If they are in the central medical stores and they are supposed to be delivered through a logistic management system, automatically this can be done through requisition. So if the hospitals don't have, we expect them to make the requisition to the National Pharmaceutical Services, who will supply them through the normal system.
One would have thought that these things should have been put in place in the hospital right away, to waiting for whoever might need them, and not needing them and then start looking for them.
No, that's what I'm saying. It's the management of the hospital that can also think ahead of this. Like, for example, you know what you want as a hospital. Perhaps the hospital, they have an administration, they have their, all their setup. So if they can be able to focus as to what they want for maybe for the next 3 months, and they can make a requisition to the central medical stores, and they'll be provided with the equipment.
Now let's go to the number of deaths. A lot of people don't believe that 19 is exactly the correct figure. They said this might be a very, very underestimated number or underreporting of the number of deaths.
That is a belief. When people believe in something, it's difficult to change. That's why I wanted to come back to Nyima's point that we are not doing much. No, that's not the case. Because when people believe in something, it is difficult to change them from that point. It has to be a gradual process. And as you know, communication, going through the different ladders of change, for example, the different change theories, people change from one level to the other. So it has to be a gradual process. So people believe, if this is the belief that they have the belief that people are dying at home and they are not recorded. And that's because why many people are now hiding certain deaths. Because they feel that when they take it to the hospital or when they announce it, they might link it to COVID. So this is why our approach has also changed, because we have been communicating, we have been using several approaches in communication. We have been using the 3 main strategies: communication, social mobilization, and community engagement. And I think this is something that we have been doing. And then now that we are also engaging them on the issue of, for example, burials. We know we have challenges. So that at least these bodies are normally being managed by the Red Cross volunteers, and then some people don't feel that this has happened. So, and they have difficulties. The local volunteers really and our team have some challenges. So that's why we have been talking to the community to break those barriers so that when there are deaths, we want their participation, we want their collaboration. Let them report these deaths, and then we will take the appropriate action to advise them as to what burials are to go. And these burials are done in a dignified way, and also in consultation with the community, with the members and families of the deceased. So this is something that we have been doing, and I think the bodies they are talking about, we want to also appeal to the public. If there are deaths in communities, let them report it. Let them report it.
Should this now be all deaths, or people they suspected were showing symptoms of COVID before they died?
No, actually, what I want to say, like, hence we have community transmission now. So definitely, it is advisable to report all deaths. Because hadn't been we didn't register community transmission, then it wouldn't bother much. But now we are registering community transmission. It's also important that we register all deaths in the concern that we know, and these deaths are going to be investigated, and samples are going to be taken and analyzed, and as well as if there are contacts of those dead bodies, we're also going to make sure that contact tracings are also done. So this is the essence of that.
Okay, right, all right.
And that's important to report. Yeah. Otherwise, if you don't report it and appropriate actions are not taken, then you might be dealing with a situation where you don't know, and then it can also result in some complication in the long run. And that's what we have been doing. We also want to assure you that, and the team, that since we started this engagement, we have been using the print, the electronic, and the traditional media. And then we want to assure you that with the traditional media, we have been engaging the Kanyeleng, the community drama groups, the other things, we have all other sort of entertainment, and just where we can be able to send out messages across. Okay. We have been doing that. We've also been engaging the religious leaders and the traditional, we call it the district authorities. And the district authorities are the chiefs. These are the chiefs we engage all the time. And when we engage them, they also go back to engage their alcalis, and alcalis also go back to their villages and engage their household heads, and household heads also engage their family head. This is what we have been doing, and that is why nowadays we are not having that much resistance. We are also doing what we call using the voices of the people to communicate to their own people. Like we are now using the positive defiance approach, that the people who are already been positive, and they allow them to talk, and also even our health workers are also now talking to the public to assure them and to tell them that the disease is real. And
that's quite important, because a lot of people really said
we are using all the community radio stations. Now, can you allow me? Yeah. We are using all the community radio stations across the country, and we are using key influential leaders. These influential leaders are coming from the communities, not from Banjul, Serekunda, or so. Like, for example, we have a radio station in Bansang. We are talking to influential leaders in Bansang who are normally doing the program with our health officers there. And then the people are now hearing the voices of their own people, the chiefs, the influential leaders, and so on. And then that is really helping us a lot. And that's why everybody is now calling, I want to test, I want to know now, I'm afraid, I think I'm concerned. Now people have seen the disease as a reality. And now
you mentioned stigmatization. So, I mean, high-profile people who came out publicly to talk about their status, such as the announcement about the ministers and the mayor of Kanifing. I mean, those are good efforts in demystifying the virus and let people stop stigmatizing, isn't it?
Sure. That was good. That's what we will continue to do. And then, we also have to thank your platform that you have given us enough airtime to be able to talk to people. Absolutely. And people have been following our discussions with your platform, Fatou. So really, I think, we have done a lot of work. A lot of discussions have been done at the beginning of the COVID. Absolutely. And up to now, we have done a lot of engagement, and this will continue. Communication is a dynamic process, and we will continue, and we will change it along the way, the strategies that we feel that we should be implementing. So a lot is happening, and I think we are not blaming the people, but as you know that Sankanu can tell you, we went to solve the problem in Numuyal. Whilst we are in the community, we discussed with them, and I'll just give you a scenario. We discussed with them, they almost agreed, but somebody outside he's part of the community, but he went outside to another village, he prepared an audio, sent it to someone at the meeting ground, and then they listened to it and they were passing the audio, and then they started, trying to go against our idea. In fact, what we have agreed upon. So you can see some of this. That is why I say some people, we find it difficult to convince them, because these are these pockets of people around who are there when we are doing good things, and they go and make some certain videos or audios and circulate and share. So when that thing happened at the beginning, that has been a challenge for us. So, but we also started countering those rumors and fake news. That also really helped us a lot. So we alongside with the other companies, and we have been doing. So this is what I want to highlight for now.
Fantastic for now. Now it goes up to Sankanu, because you sit in the committee that advises the government. The issue of the airport has often really been talked about. Nobody knows what's really the policy of the airport, Sankanu, because the thing is, whereas you told people that the airport is closed, here and there, people fly in, and we see them, struggling or complaining about quarantine policies, etc. What is the policy of the airport? Why are planes still coming when you said it's closed?
Thank you very much, Mr. Cham. Before coming to that, I just want to add to what my sister is saying about strategy. Right now, I'm working with the National COVID-19 Response Secretariat, the new coordinator that is appointed. We are at this moment working on replace the one that was there in the beginning, and the one that was prepared by the Ministry of Health. Now we are having a cross-cutting strategy, national strategy, which will come hopefully next month. We'll launch it. As I speak right now, the draft is ready. There's also a standalone national communication strategy on COVID-19 response and recovery, which I already drafted. So we are reviewing it, and it will come out, and we'll launch it next month. So the issue of a comprehensive, coherent strategy is something that is being worked on. So we are working on that. Coming to the airport, indeed, when there are restrictions, there are always exceptions to every rule. We open the corridor to make sure that life goes on. Humanitarian flights are allowed. We need humanitarians. Borders are not closed for essential commodities. People still need to survive. That's important. Planes that are bringing essential cargo, humanitarian cargoes and other things, like the plane that brought in the 10 ambulances. It's necessary. The country needs those ones. And there are also compassionate flights, dead bodies that can come, because there is a law that you cannot stop a Gambian from coming. Every Gambian has right to come back to the Gambia, dead or alive. So at the time of the border closure, airport closure, a lot of Gambians were stranded, at the Brussels airport, or they already bought tickets. So the arrangement was made to give those people the chance to come back home, because when the Europeans were evacuating their citizens, the planes will come one way and go empty. So when they're evacuating their citizens, these are evacuation flights. So now, before it was the Europeans who are taking out their citizens. You remember there were debates, why are Gambians not coming back? We say we are looking on it, we are working on the arrangements. So these flights that are coming, they are not normal, commercial flights, they are granted exceptional permit to bring in Gambians who are stranded, in those countries, and they want to come. And when they come, they have to go through those procedures. And anyone who violates those ones, you'll pay 5,000 fine. So Gambians who want to come back home. So if you have an European passport, the airlines might not allow you to board in, because we've got requests from people last minute who are stranded at Brussels airport. They wanted to use their European passport. I said, no, if you want to come in, you are a Gambian, you have a Gambian document, present it, they will let you board in. So the language is very clear.
I saw now
Gambians, diplomats, and humanitarians. Yes, go ahead.
No, are you sure now that it's not just people who stranded, Gambians stranded around the world, people who live in the United States or the United Kingdom or Switzerland wanting to come to the Gambia, maybe for holiday or to see their people, and they say, okay, I don't mind going to quarantine, I want to go to the Gambia. Is the airport not closed for those non-essential traveling?
Well, what is non-essential? Like you said, if you're having a Gambian citizen, essential or not, it's like, okay, the non-Gambians, they have to give a reason. You have a business or you have something important, but a Gambian, you have right to come back to this country, that is the law. So we encourage people to stay where they are. But if a Gambian comes, that's why even those who sneak in through Senegal, we take them to quarantine and we don't penalize, because you are a citizen. It is your fundamental right to come back to this country. So, but we try to make sure that it's done within. So that is this their human right. We cannot take that from them, but they have to follow the procedure. And then at times when it becomes overwhelming, that's why we have said they have to participate in the cost of quarantine. Maybe that will serve as a deterrent. You have to pay at least $30,000 to the government before you arrive. Hopefully that
has that been put in place now?
Well, it's been worked, it should be on. And I think yesterday the director of health promotion, the leader of our risk communication, Mr. Modou, Njie, was working on something like that, which basically I think it will come out as soon as feasible. The language of the text, the vocabulary is being prepared, put together, and it will be communicated to the public. So like I said, Gambians have right to come, but when it's becoming too much, they have to participate in the cost of quarantine. And you have to do quarantine test at least 72 hours before flight. We are all trying to live with COVID-19, so we cannot restrict people forever. All these things are measures trying to learn how to live with this pandemic as we try to contain it while trying to also move towards the mitigation stage.
Now, but at the moment, it's not correct to say that airport is open to all normal commercial flights, no?
Yeah, it's close to normal to commercial flight. All humanitarian, evacuations, diplomats, humanitarian. So a Gambian who is coming, those flights are classified as humanitarian. So if an SM Brussels comes with Gambians, they ask for permit and apply as humanitarian airlifting Gambians who are stranded.
Ah, okay, that's what it comes. Okay, that's understood. Hello, are you with me? There seems to be a problem.
Evacuation. That classification, we follow the language, the legal language, you know. So follow the procedure, go do the quarantine. If you are free, you go back. And then if you are sick, no, the state will take care of you and take you to a treatment center.
Good. All right, Nima, you had all this out there in Springfield, Illinois. If you really should, you plan to come back now? Are you really impressed with, you know, coming in and out, you know, as far as those things are concerned?
Lamin, so there's a disadvantage when you're not in the studio because there have been many things that have been said and I have comments on. Yeah, so I would like to comment.
Well, none of the people none of them is in the studio anyway. You know that it's only me in the studio.
That's what I'm saying. I needed to be in the studio with you.
Okay.
Yeah, but I just wanted to comment on few things, two things to be specific before I come to your question. The thing with communication. I think if what we suggest should happen is, as Modou said, is what is happening now and people are getting convinced, that is something that they need to be commended on. And the reason why we raise these concerns is because we know that it's a concerted effort. They are the ones on the front line. They may not have all the answers, but it's important that we listen to one another. We do not suggest to have all the answers, but everyone has an opinion. And when you have opinion, as authorities, it's important to listen to diverse opinions to make an informed decision. You don't have to take every decision because that's a problem too. What we are seeing from the Gambia is authorities reacting to every opinion online, on social media, on all kinds of media. Everyone is going to have an opinion, but at the end of the day, what you do should be strategic, it should be informed, and so on and so forth. But again, I just want to come back to sustainability. Are we going to be able to sustain what is currently happening with communication and convincing people? Because I just want to emphasize again that at the beginning, many people were convinced, but we were not able to sustain that effective communication that arose initially. And here it's important to be consistent with what we do. And some things that I see that are concerning for me is the fact that the leadership is not coming out to inspire the public, to ensure that we understand that there is a fight and there is somebody at the head of the helm of affairs to lead us into that fight. The president needs to be visible. The president needs to be with the people. He needs to be seen to be at the forefront of this fight, because that is the only reason why people can continue to be convinced that, in fact, if the president is concerned and he is constantly out in the open to declare war on this pandemic, then we have no reason to lag behind. And I see communication comes in different forms. I see Mr. Njie, I don't know whether he had a heavy breakfast or not, lying comfortably down on his sofa. I have seen in other interviews as well. It doesn't show urgency. It doesn't show urgency. It doesn't necessarily show that this is a high risk. People need to be convinced that this is something that is serious, and it should show in the way that we speak to them, in the way that we comport ourselves, in our body language and all of that. most communication are coming through press release from State House, for example. The daily reports that we are seeing are coming through press release and so on and so forth. All of these things, they do not show emotion, and emotion is very important in communication. People need to connect with you to be able to really understand what you're saying and to take cue from what you're saying. But again, people are getting convinced. I agree with you, because when I see religious leaders coming out to talk to the people, I said, now we're doing something right. So it's not about doing something, it's about doing the right thing. If you test your strategies initially, it doesn't work, you need to change course. And I'm glad that that is happening. And again, I think something that we're missing also when we talk about proactivity is people need to be really mobilized in different areas of our approach to fighting this pandemic. Research is very important. When I hear Mr. Njie, Modou Njie saying that nurses could have contracted this virus at their homes or on their ways to the hospital and so on and so forth, I'm thinking, I can speculate, but you are not supposed to speculate. You are at the forefront of this fight. It's not right for you to speculate. It's important for you guys to gather the necessary data. And that should be a continuous process. That should be ongoing. There should be a set of people who continue to collect data to understand the trends. Where are they coming from? Because at the end of the day, if you want to fight, you need to understand the circumstances. If you cannot declare a war on something that you do not understand, you do not understand where it is coming from, you do not understand the trends. It's important for the health ministry to have a whole department that should be on top of things at all times, continuing the research, continuing to understand the nature of this virus and its dynamics and its trends. Where are the clusters of people that are getting infected? Where are they getting this infection from, this virus from? How can we ensure that we're really working hard to curtail the source of the virus?
Wow.
But coming down to your point, I think it's fair for people to understand that at this point in time, whatever personal choice you make, there should be a cost to it. So as an individual, I do not mind coming back and be responsible for my own costs to be quarantined for 14 days. Because at the end of the day, what affects me affects a lot of other people. And I cannot choose to, I cannot make a personal choice for my own pleasure and have that cost be a burden on the majority of the Gambian people. But again, I hear 30,000 and I'm thinking, would 30,000 be the cost of my quarantine, or is the government making a profit out of the personal choice that I make? Because whatever I am supposed to spend on quarantine should be the exact cost of my time in quarantine. That's important.
Actually, I heard there is 32,000 the government is paying and each person been quarantined. 32.
Yeah, so whether it is 32, 30, 50, I just want to make sure that we're making sure we're not making profit out of it. Because mobility is a human nature. It's always going to happen. People are going to move for various reasons. It may not be essential to some people, but to the individual that is making the choice, it may be the most essential thing at the time. I think it's very risky now to travel. So if people are making personal choices to travel across the globe, that is something that we should understand. And I'm not saying this because I have traveled, but people are always want to go back home. I know friends who are stranded in countries that want to return. They have finished their studies. They want to come back home, but there are no flights from the countries that they are staying now. They cannot go back home. And again, as Modou Njie said, it's a human right for any person to have the right to return to your exactly.
That has been
So,
Mr. Sankanu's point.
bearing the cost of quarantine should come as a cost to the personal choice that we make at this point.
Fantastic. Okay, Njie Kamara in the United States. Thank you very much for joining. We are scaling down now. I think it will be right we go now back to the PRO for his final thoughts. And PRO, what I want to begin that with, I want to, ask you, in enforcing these regulations this time around, for example, the police, have you come across or even had allegations. This is dealing with immigration, of course, but you must have feedback that, I mean, travelers are saying that there have been allegations. But somebody's son is really not. Somebody somewhere is. I think Lamin, Njie, your son is coming up to your aid, perhaps. Okay. You had allegations that some people traveling said, you know, either they allegedly bribed immigration officers or police to escape quarantine. The immigration have denied this. Is there any truth in this?
Well, we have also received reports of this nature. In fact, if you have been online and on the social media, a lot of times these reports are coming in. People alleging that officers at the quarantine centers or support centers are receiving bribes for other people to escape quarantine. And so far, we have opened up investigations at our level regarding the officers that we have attached to the quarantine centers to ensure that these things are verified facts before we can say anything about them. And even not long ago, we have also received similar reports as well. And so what we are doing right now is to diligently investigate, because we cannot just go by allegations and counter allegations that are being made, but instead we want to go by verified facts so we can be able to authoritatively comment on this. And in fact, we are liaising with most of our officers, especially the police officers that are attached to the quarantine centers as well as the escort of the COVID frontline. Those officers are answerable to the tourism security unit right now. And the tourism security unit is adequately engaged by the police command to see to it that effective investigation is launched into these allegations to come up with a conclusion as to how is this happening and where and who are the people involved, so that if those things are verified, then we'll be able to authoritatively comment. And we want to assure the public that once we are able to establish such thing, we will not hesitate to come out with to the public to inform them that this is what has happened, and the appropriate action that the police command is going to take, we will come up with that as well. We have definitely nothing to hide. We want to be held accountable by any individual. The Gambia is a country, and as far as the police force is concerned, we have nothing to hide from the citizens of the Gambia. And so that is not a big deal for us. But first of all, we have to verify the reports before we can be able to authoritatively. And
finally, very quickly, so far so good in terms of the enforcement of the regulations, very quickly.
So far, so good. We want to assure the public that the police will be out and about every day almost, especially within the course of these 21 days, to ensure that the curfew regulations are enforced and to ensure that the mandatory face mask wearing is also enforced and the accompanying regulations. What we need from the general public is their support, their compliance, and their cooperation, and also to advocate for community policing also, because we understand that the police cannot be everywhere at times, but community members are everywhere at all times, especially the VDCs. I'm happy to say that there are certain VDCs and certain youth groups that are definitely doing tremendous to ensure that they police their areas, and then they are responsible to pass information to law enforcement at any time when they are having it difficult to deal with those circumstances within their communities. I think that's a good spirit, and people need to keep that up. And anytime they see that something is going on within their communities that is endangering the life of the people, they could come out and share this information with the police so we can act as quick as possible to deal with that. COVID-19 is real, and the best thing we need to do is to stay at home. And where we cannot stay at home, we have to be out. We ensure that we are wearing our mask at all times.
Fantastic. Sankanu, very briefly, and just to summarize, Mr. Sankanu is not on the screen at the moment. Maybe he will come later. So let me go back to Modou. Modou, you've had those observations, or Sankanu is there. Sankanu, okay, let's go to Sankanu instead. We will end up with you, Modou later. Sankanu, you had those observations that perhaps when it comes in terms of communication, people in government, high in government, such as the president, should have been in the forefront engaging the people. A lot of people have said president have not been seen, you know, when all these new developments have been communicated, even though, to give him credit, he came out with very tough measures that are seen to be very, very good in spreading, in curbing the spread. But where is he himself? Why didn't he feel it necessary to come out himself and address the issues, the nation, for example?
Well, from the onset, this has been the debate, and that's why I remember making sure that Donald Trump coming out every day and talking does not stop the spread of COVID-19.
Yeah, but at least
same applies to we are working hard with institutions in place. Let me come.
Okay,
the leadership is there.
Yeah.
He will come out and speak at the right time.
So this time is not yet right.
Following the contraction, the contact with the vice president is positive in the treatment. And there was an announcement that the president is on self-isolation for 14 days. I mean, it is reasonable that we don't expect him to break that cycle of isolation. Let's wait, let him complete that preventive isolation, and we will. So the speech is already written and ready.
I see. Okay.
The government spokesman are reading it. So people are, what I said, they are aware, because all these public reaction and public concerns are transmitted to him immediately. He's aware.
Okay.
He will come and address the nation. Like I say, anybody who wants to know more, you contact the government spokesperson or the presidential spokesman. But I know that you'll come. But right now we cannot, take the risk of breaking the 14 days, self-isolation and just say that just for the sake of, political expediency. We still have to be reasonable. Emotions are important in communication, as my sisters are said. But reasonable is very important. We have to at times keep the emotional distance and look at what is rationally feasible. And at this point in time, he will come out and speak. But let's allow the self-isolation to come to an end. Yeah.
Fantastic. Now, Modou guys, finally, you have the last word. I mean, the whole nation's hopes rest on what is available in terms of facilities and health personnel. Now we're going to these tough times. Can we expect the worst, or have we flattened the curve now? Or are you maybe sadly foreseeing that we may have to, it has to get worse before it can get better?
Thank you very much. I think basically we are still working very hard in collaboration with all the partners, and all the stakeholders are doing what they are supposed to do. And this spirit is continuing. And definitely with this spirit we are going, sure, we are going to see the light at the end of the tunnel. We're also assuring the public to stay calm, and there's no need for panic or alarm, and the situation will be under control. It may not be now, but we are working very hard to just try to flatten the curve. We're still having the numbers. As I said at the beginning, we have a backlog of samples that have been collected. And then if those samples are analyzed, and then we know our results, and then that is also determined as to where we are. And we still continue allow the people to come and test. And the more people we have that are tested, coupled with the people also adhering to the precautionary measures, and also the full implementation of the state of public emergency regulation. And I think with these strategies together, we can be able to flatten the curve to at least a level which everybody will feel happy to say we are able to contain the virus.
And
but it needs a lot of work. I just want to say we need to stop the victim blaming, civil society blaming the government, and then other people blaming government. Government alone cannot do it. We need the collaboration and support of the civil society, and then we need this collaboration of family members, communities, or the private sector. We want everybody, what we have started at the beginning, the spirit need to come back again to continue the fight. We have not yet conquered it, so we still need the spirit. We still need that spirit to come back again. And we need the media support, and then you have demonstrated that. We want you to continue. And we want to assure our colleagues that the ministry have a fully functional director of research. And I was not speculating, but I was just saying we couldn't determine what will be the cause of the transmission. It will be premature for me at this point to say this is the point of or this is the cause of the transmission for health workers. It will be too premature for me, but I think the research teams and the contact tracing teams are doing their work at the moment, and they'll give us the findings. And when they get the findings, we can be able to communicate the findings to the public. I think I want to assure the public that we want their support and collaboration, We want them to cooperate with the security forces. We have seen what is happening, and we want their cooperation to continue with them because we have seen a lot of cooperation across the country. So we want that to continue, and we want to ensure that people observe social distancing, and then we make sure that we put appropriate face masks, not face masks on the cheeks or halfway. It has to cover both the mouth and the nose. And I think this is something that has preferably the material that is made out of cloth, which you can be able to easily clean and dry and use it, or you can have 2, 3 at a time. You can be changing them. And we don't want to encourage people hanging masks also in vehicles, where people come in and start changing, use it and hang it there. If any driver does that, the passengers have the right to report the driver to the nearest police station or to the nearest police officer or to the nearest police checkpoint for the passenger to be arrested. Because it's just equally just like somebody breaking the state of the emergency regulation. So I think this is something, because you are trying to promote the transmission of the virus.
Exactly.
This is something that we are not going to encourage. We also want to encourage the public to continue what they are demonstrating. That's the issue of hand washing. We want them to continue doing that. That will also going to help. And to continue surveillance at the border communities. The borderline communities, we still need to continue the surveillance to make sure that people who are coming in and out are monitored. This is also going to help us a lot. Thank you.
Yes, just finally, you said there's a research of the ministry. Let me ask a layman's question. From what you received from the international collaborators, how far are we from a vaccine, an effective vaccine for COVID?
The messages we are getting, there are a lot of research organizations that are working around the vaccine trial. And so anytime we also get into the process, we will communicate it to, and we will definitely be involved in it. But when we are communicated, I'm sure other countries are trying to see how best they can introduce vaccine trial. If they are also applicable and then approved by WHO for us to go ahead as a country, I think we are also going to go ahead, because knowing that in the Gambia, a series of vaccine trials have been done in this country. We talk about the pneumonia vaccine trial, we call it the pneumococcal vaccine trial. We have the hepatitis vaccine trial. We also have so many trials here. And today, we are using those vaccines in our routine immunization services, namely the pneumonia vaccine, the hepatitis vaccine, and this is really helping us to cut down the number of pneumonia and hepatitis cases in this country. So if vaccine trials are to come into the Gambia with regards to COVID, and it's been approved by WHO, the approving authority, I think we will also go ahead and then see what is possible. But we haven't got that information yet. But if they are to come, we'll still have to follow the normal procedures, the ethical procedures, and so on until such a time that clearance is given. And if that happens, I think we have to go ahead.
And you don't know from United Kingdom, for example, they're talking about October, US talking about December, Russia talking about October, yes.
Yeah, maybe they will start there, but you know, some of those they start in other countries before we started. So if it is to be done in that countries in December, we might also not start in December. It's possible. Or maybe the principal investigators in those countries perhaps could also be people who are also working for us here. We don't know. But when the information is available, we'll come back again to the public to inform them as to what the country plans with regards to vaccines. Or vaccine
Modou, well, Director of Health Communications, Health Promotions at the Ministry of Health. I wanted to promote you to be a doctor because you are more or less a doctor these days. Thank you very much for your time. And then to Baboucarr Sankanu is a communications specialist in the COVID Emergency Committee. We have Police PRO Lamin Njie, now Superintendent, who also informed us, updated us, that is, on the enforcement of the rules and regulations concerning the new emergencies to curb the spread of COVID. And my sister and colleague Njie Kamara, who is now in Springfield Town, Illinois. How's the town is compared to Collier or Brickawa?
Compared to Collier, it's not nearly as good. Okay. But compared to Brickawa, it's the best place to be. It's very green here, very, very, very green, very quiet, and people are really, really polite.
Okay, thank you very much. Enjoy your stay. And to you all, gentlemen, thank you very much for being on the brunch. Until we meet you again, perhaps, hopefully next week, when we will have perhaps very little cases to report about, and suddenly no date, and hopefully no date Until then, Lamin Cham here, wishing you all a great week. Goodbye.
Thank you.
Thank you.
Thank you.
Yara nyilla domoro kadiyate.
Boy, jannon Sikes restaurant.
Sa na ko be ni na dimbal. Nimba domoro kala janno.
Domoro seneyata adiyata topotoro fanan kende ma bije. Luntan during tamala abeka domoro ki janni. Adi manda wala de. Teka we bijele anim fanan ka fadi jang ikono e fa. E ka fa minne ko pastry anim bakery. Iko fanan bekalele. Badde lomba conference lomba workshop lomba ye fo fendil lo dunia kono domoro betama nyillom international o toda number 1
amanke ba domola jandama
esa domo jang is atariya
wo mu kubandi
sa na ko sa futandin
oto sa na ko be mu Sikes restaurant
ndafa na janna mu yat ni manje dorom bija
aban
Sikes restaurant, known for best quality food and customer satisfaction.
Miss B Designer Outlet is the #1 quality and affordable stop shop for all your needs. Get your evening dresses, suit and ties, office wears for both ladies and gentlemen, beach wears, sport wears, pure leather shoes for men, quality belts, bags, heels for all beautiful ladies, original perfumes, accessories, and a lot more. Find us at Kololini Road opposite Gaddafi Mosque at the Aqua Bridge Station, or call us on 295-3411 or 764-2486. Miss B Designer Outlet. Shop right, look good.
Love like fire. Wow. Love like fire. Xam ngeen rek affaire bi xam ngeen fan la? Skincare la. 2020 lañ wax de. Waaw. Fii nag mooy Kerr fan, Kerr zero tache. Perfect skin. Skincare saa su ne rek niñ ko dee defee rek. Loo lañ soxlaati rek. Maanaam bu ngeen am problème ci seen skin, ngeen xam ngeen fan la. Fii ngeen di ñëw. Suma xarit yeeg am di jàmm yi nga xam ne taas daf lañ sonaloon xam nga doon xeesal benn la ka xum éneew ma lañ ko nag waaye just in case comme ni ko gars yi defee rek en cas just in case loolu xew xam ngeen fi ngeen di ñëw skincare plus si yu baax rek la ñoo dox nag ay baax rek fu ne la ñoo dem ci réew mi di lañ indi rek nag products yu baax du Paris du Italie du USA du fi mu nekk nii sax boole nañ ci nag Sweden fu nekk lañ leen a indilee products bu dee tamit nag da nga ñuul rek ñu lay jamaa natural beauty that melanin dripping we do have stuff for you as well emuñ si skincare products rek ñu ngi ci cuub yi tamit fu ne la ñoo jaar in fact sax last commercial bi ñu defoon waxuñ leen woon dañoo dox ci ay kawar 9A grade rek nag waaw we do have bundles as well hair si lu ne la ñoo dox ñun ñu ngi ci rafetal jigéen rek luy taaral jigéen rek waaw boo leen di tukki tamit bëggoon that classic suitcase ñu dañoo dox ci ay Samsonite duñ dee indi any brand of suitcases though other than Samsonite comme li ma dee wax rek boo eggee airport dëri Samsonite dafa am nuñ laa xoolee waaw ngeen ne lan nag waaw skin ci moom la ñu gën a xamee nag skincare products ci moom la ñu gën a xamee ñu ngi dox tamit bentee tamit si ay dàlla man waaye man nag skincare mooy suma specialty xam nga rek jigéen bu sa xar kanam réglé loo def mu jag am nañ Patricia Reiner, Kiwi Eye, the whole range, Lighten Up Gold, Tomatine. I mean, the list can just go on and on and on and on. Lépp loo xam ne rek luy taaral jigéen la ci yooyu rek la ñoo dox. Skincare plus nag emuñ si Gambia rek ñu ngi United States ñu ngi Gambia fii ba pare bu dee yaa ngi anywhere in Europe mun nañ la ko mail within 3 days rek ñetti fan rek nga jot say diw emuñ si loolu rek dañ laa consult tamit balaa ñu laa jaay diw dinañ def a free consultation pour wax la rek exactly li nga xam ne moo méngoo ak sa kanam dinañ leen wax tamit ne rek am nañ perfumes, you know, fragrances, men's shirts, accessories. We do dresses as well. We do blouses. I mean, we do shoes. Name it, we do them. Skincare Plus 2020 is our year of perfection. Zero task. Fi mu nekk nii réew mi fii kenn waratu fi task kenn waratu fi am problème kanam kenn waratu fi am problème yu picca boo ko amee dafa fekk ne rek ñëwuloo ci place bi fii.